I'm Aditya Bardia. I'm an attending physician at Massachusetts General Hospital Cancer Center, Harvard Med School, Boston. I'd like to talk about a study with a drug called RAD1901 or Elacestrant for patients with metastatic ER-positive breast cancer. This was a phase 1 clinical trial that looked at the activity of Elacestrant or RAD1901 at 400 milligrams, given orally every day, once a day. 40 patients were enrolled in this clinical trial. The eligibility criteria included ER-positive metastatic breast cancer. There was no limit on the number of prior lines of endocrine therapy. There was a limit of 2 prior lines of chemotherapy. Patients received Elacestrant as long as they were tolerating the therapy and as long as there was no evidence of disease progression as per standard RECIST criteria. So in this clinical trial, in terms of demographic background, patient had received a median of 3 prior lines of therapy. The range was 1 to 6. In terms of clinical activity, the objective response rate was 22%. The clinical benefit rate was more than 40%, and the median progression-free survival was 4.5 months. In terms of the safety profile, the most common adverse event noted was nausea and dyspepsia. There was no signal as far as neutropenia was concerned or diarrhea was concerned. So in summary, RAD1901 or Elacestrant demonstrated encouraging evidence of clinical activity in heavily pretreated patients with ER-positive, HER2-negative metastatic breast cancer. If we were to put this in clinical context with other endocrine therapy agent, one trial to reference would be the BEL-3 trial, which had patients with metastatic ER-positive breast cancer that had received a number of prior lines of therapy. And in that setting, the median progression-free survival was 1.8 months and an objective response rate was 2%. So compared to that, the results of this trial are very encouraging, but this was a phase 1 trial. It should be noted it was not a randomized trial that directly compared fulvestrant with Elacestrant. The other point I would like to make is that in this trial, patients were treated with prior CDK4/6 inhibitor, prior fulvestrant, and in a patient who had received prior fulvestrant, evidence of partial response was seen. The other thing I would highlight is that because this is an ER degrader, there was interest in looking at ESR1 mutations, because when a tumor has ESR1 mutation, that confers resistance to aromatase inhibitors. So in patients who had ESR1 mutations, even in that setting, evidence of clinical activity was seen with this agent. And by tracking ctDNA, we observed a patient who had elevated ESR1 mutation, but with the introduction of this agent, the mutant allelic fraction of the ESR1 mutation decreased and essentially became undetectable. So potentially this is an agent that has clinical activity in tumors that are ESR1 mutant.